Hello, guys. Welcome to my channel. My name is Felicia. I am an RN graduate from 2020. I graduated school in 2020. I recently passed my boards for the RN exam. I passed on 329. So after failing about 5 times, I took the test in a total of 6 times. I passed on my sixth try with Florida. Thank God, because I was not gonna go through it again. But yeah, I wanted to give you guys some insights, some tips on taking the exam that actually helped me. And then I finally start to realize, like, you know, what the test is really about and what is it really asking me when it's giving me these questions. So with the exam, I used Princeton Review. I highly recommended it. I highly recommend it. Sorry. Because it breaks down in categories. It gives you, I believe, it's 7 to 8 categories, which the NCLEX tests you on. And it breaks down the categories of how the questions are going to be coming to you. So I felt like that was a big help. I actually had got it free when they were doing the 30-day trials. I actually did the trial about 2 times. I didn't pass in, this was before I actually found Princeton Review. I took, because I was using UWorld, I was using Archer. It wasn't helping me. I felt like it was um, extreme. Well, UWorld was okay. I felt like it was fairly a little too easy because I was getting everything right, but still, my exam, my NCLEX exam, it wasn't that easy. And with UWorld, the questions weren't vague enough for me. But with Archer's extreme, I felt like it was too hard, and it didn't too much relate to what NCLEX was showing me when I took it again, and it was just confusing. I was using Archer, I was using UWorld. I like UWorld. UWorld is okay. It's like for a basic, understanding, but it didn't have me actually critical think enough and prepare for NCLEX for me. Archer, I felt like it was just out of there. It was just too out it was straying from the point to make about the exam. I had the full package. I had with the videos, the live help and everything. Like they're okay with certain like content. I would recommend Archer as like a content review, yes. But the bank wasn't too good because it had a lot of mistakes and stuff. It kind of threw me off. So I personally wouldn't recommend it as like for questions, but for content, yes. Um, and then I had failed December 20 something of 2021. I took my test March 29th of 2022 and I passed. And what I used from December was Dr. Z, his free content that he provides on YouTube, and also I attended his weekly his Wednesday Zooms. He helped me to actually think, understand, understand what is pretty much the severity. Like look at it as in a severity type situation of what's going on. He really like got my critical thinking out there. I'm like, okay, all right, if the heart do this, what's next? What would like it was just back and forth, especially when he talked about cardiovascular and stuff like that. I felt like I really understood at that point. It was more to it than just questions. because you can always do questions, but you have to understand what they're asking you, what they're looking for, and what they want you to answer. You're not going to add anything into the question. Pretty much, don't look for nothing else than what they are actually asking you. So I use his method and his ask graph, which is golden. It works very well. Um, yeah, and then from Dr. Z, I felt like that was like my foundation. It put me up pretty much. It gave me a foundation, and then I was right here. I was like, all right, I got Dr. Z, I got some methods, I got something to use. I needed to find something good for questions, something strong, something that I have not used before, because I used Archer and UWorld before. The questions are repetitive. I could not use those banks anymore because I felt like I would be answering because of previous knowledge of being used to answering questions from that bank. So that's why I felt like it was repetitive and it wouldn't work for me anymore. So I was in a search of a bank, and a really good one, not know all these, because there's plenty of banks out there, but is it good? Is it hitting topics like how the NCLEX is going to be throwing stuff at me? And even though I don't know what that specific disease is, I need to understand. I needed to understand, okay, they gave me a disease. Maybe it's not about the disease. Maybe it's about something else in that situation that I'm like, okay, all right, so I know this disease is pertaining to which body part. I try to put it in that way. Like I would rephrase the question, I would break down the answers, I would look at the answers, I would be like, okay, do this, do this, does this answer relate to the question that's being asked? And I would look back at it, and then I would probably already cancel out about two. I always get down to about two good ones. And then I go back to the question and I look at it. I'm like, all right, there's something here that they want me to understand. There's something wrong. There's something that I need to do now, not later. I don't need to pick an answer that is for later. I need something as me as a nurse that I can do now to help this patient. That's how I was looking at the questions. I need to do something now. Apart from, if there was questions that I needed to reach the doctor or whatever, then that would be like priority. Then I would call the doctor, stuff like that. But me as a nurse, I put myself in the situation and say, there's something in this question that they're asking me that I need to do or I need to know. They even gave me like a report. Pretty much, I'm reading up on a client, where you have the labs and then a little history, and then there's something like, oh, it's a, I find, and they give you like SATA. With the SATA, and I find more than one problem. I see the main one that they're talking about, I picked that, but then I found like, okay, they have hypertension but they're getting a regular diet. Like, why are they getting a regular diet? Because regular diet can, have a lot of salt in there. So I'm like, oh, I would question the regular diet too, even though the situation is SATA. So you need to pick everything that's pretty much wrong, that you would question, apart from the main problem. So apart from the main problem, okay, you got that right, but there's another answer in there that you need to click. So I was like, okay, it says they're getting a regular diet. I'm going through the chart. I'm like, I don't think they're supposed to be getting a regular diet with hypertension. I think we need to do something about that. So, and then not only that, I chose one answer, I chose another one, because I was like, okay, I see a problem there, and me as a nurse, I would not let that slide. They can't have a regular diet because that's not helping their condition. So it was things like that. I felt like it strengthened my critical thinking. I have a whole different outlook of the test when I went back to take it. Um, Princeton review. I'm telling you, it breaks it down by it's like not. I believe they change it now, so it's not free anymore. It's actually $99. I don't know how many days of the bank they give, but you can go on PrincetonReview.com and actually look. I did the RN exam, the registered nurse exam. Um, that's the one that I did. I don't know what other exams they have. I was pretty much looking for that one, but luckily I got on the free trial that they was giving away 30 days, and I had the whole bank. It was like 25. I think it's over 2,000 questions. I believe it was, and it was section health promotion, um, reduction. It was pretty much all the categories, and it was 20 set. It was 20. They had about maybe about 15 sets of 20 in each section, and then I would do 20 from each section per day. So, and then I would look at the rationales, and then I'm like, and then I would understand. I'm looking, and then I'm looking back at, I'm using Dr. Z method and the axe graph, and then I'm using my common sense as well. Okay, would I do this? Would I do this first? How would I give a sub Q? What's a sub Q again? And then I see the pictures. Well, I don't believe on Princeton Review they do the picture stuff. It's everything is worded questions. But I remember from NCLEX when I had it and I got it again, so I knew I was getting it wrong. But I learned from it. I reviewed my fundamentals book, just a few pages in it. I felt like I needed some more skill set. I needed to see because I probably lost that a little bit on because I believe it's with obese people. You give them obese is 90, and for regular, weighted clients, they are 45. I believe it's something like that. Not quote me, but yeah. And it was in my fundamentals book. I was like, oh, not even in nursing school. We went over this. We went over sub Q and stuff, but we didn't go over. Okay, they were if they're a certain amount of weight, pretty much they have to get the needle this way and stuff like. I never went over that. I don't know, but the fundamental books went over it, and I guess that we didn't get that in school. But anyways, I saw that on NCLEX. I knew I probably got that wrong because they gave it two times. They gave me back the same question, different way, but same question about the obese. How would you give it and stuff like that. But again, like I say, Princeton Review, Dr. Z, and what I do. That's pretty much all I used was Dr. Z and Princeton Review. After like failing at those attempts with the Archer, I wasn't getting it. I wasn't. I was just doing questions and trying to call myself understanding, even though I'm reading books and stuff like that. The normal stuff and taking notes and looking at the YouTube videos, simple nursing, yeah, simple nursing, registered nurse RN, which they are very good videos. There's a lot of information, and I kept repeating it every day. And that was December, so January, February, March. So less than 3 months, I went back and took my test, and I passed. And I passed because I started to understand the breakdown of the sections of how the questions are going to be coming to me. So health promotion are what is called maintenance, something like that. I already forgot. It's only been a couple weeks. I already forgot the sections, but the priority one, the management of care. There we go. Management of care. So yeah, management of care. That's more likely like your prioritization questions and stuff like that. I pretty much did good in that area, and so I started with that area. That's like the first one in Princeton Review. So I went there. I did my first 20. I did pretty good. I believe anything that's 55 and up on Princeton Review is good. You're there. You know something. You understand. And then I got better. I was 55 till I reached 70s, 80s, 98. Every day I was doing 20 from each section. If it's 8 to 7 sections, I would do 20 in each section. And I did it every day until I got better. I looked at the rationales and then I was like, okay, so why did I get this wrong? Okay, I was thinking about hypercalcemia versus hypocalcemia. Okay, I chose everybody, with I believe it's hypocalcemia, everything is high. Hypercalcemia, everything is low. I think that's the way to think of it. Yeah, because it's like inverse, opposite. So yeah, and then if I got something wrong based on, let's say that situation with calcium, I look at my answers and then I'm looking for, okay, if I'm talking about hypercalcemia, I'm looking for something low, if it's pertaining to a lab result, stuff like that. So I need, and depending on what they're asking me, I know I have to know, okay, hypercalcemia does this to the body, do this, do that. I need to know something. I knew a little something. I'm not saying I knew it all, but I knew what I needed to know. And that's what you need for NCLEX is what you need, is what you actually need to know to pass this test, to be a new nurse on the floor, to get running. I'm like, okay, if I see this for a patient and they're getting this, I'm like, okay, my judgment, I'm like, all right, now I can't give this. Like they have this going on. I need to do more research, and they want you to be safe. It is a safety test. It is definitely a safe, because all of those questions I was getting, and then when I actually found I wasn't even confident in my answers still. And I looked at it like, okay, I took my full 5 hours on my last chance for Florida. I took my full 5 hours. I only had like 30 minutes left when I finished. And guess what? I was looking around. Everybody was gone. Everybody left me. This was my third time going 145. The other two times I didn't pass at 145. This time I passed at 145. So that tells you something. Okay. Um, and also everybody always talking about how many questions, like all of that don't matter. You can pass at any amount of questions. You could pass at 76, 75, it don't matter the number, 103, 102, 99. Okay, it doesn't matter how many. I believe that it's actually is going by your strength in your questions, how confident you are in answering these questions. It's going by, this is a strategy to these questions. When you're answering it, how confident are you? Are you able to make a decent decision by yourself and then seek for help or whatever after that? Are you competent enough to handle whether a situation being thrown at you? What would you do? So once I finally got that in my head, that was it for me. And I felt good about my last questions that I was getting up on. I looked around. I think I was in the hundred something, and everybody was gone. And the center was filled. They had all the seats filled. I started to feel discouraged because I'm like, oh my gosh, I am the last person here. I'm like, and I looked around. I'm like, oh my gosh, I'm still here. And then I look back at the screen. I'm like, all right, I'm gonna keep going. I'm gonna keep going. I'm like this. All right, I'm gonna keep going. I'm still in the game. I'm still in the game. The test didn't end yet. I'm still in the game. Okay, I'm still in the game. It didn't cut off on me, so that means we going, we going, we going, we going. So, and then as soon as when I got to the 130s, I know I was going to 145. I was like, here we go again. This thing is not going to cut me off before. I know this. I took 3 breaks throughout my whole test. I took about 3 breaks. My first break was about at 20 questions because I started the questions they was giving me. I was like, oh, I didn't get no math this time. I didn't get any math. I got about like 2 pictures of the same thing. They gave me back the same question or whatever, but a different scenario, but the same sub Q. What's it? Yeah, sub Q. I had sub Q in my last test, just a little different, but it was sub Q again. So I believe I got it right, both of those questions, but it gave me two different ways. And then I had, like I said, a report where I'm looking at a chart or whatever, lab and history, and everything else was questions. Um, but yeah, I was in there and I was like, man, I started getting discouraged. I'm like, man, but I gotta keep going. I gotta keep going because I know I'm not coming back. I told myself, I am not coming back. This is too much for me. This is too much for your girl. This is too much for me. Like I've been out since April 2020 for school. I gotta get this. Like I gotta get my license. I gotta get my license. Like I'm tired of studying. I felt like it was taking up my whole life. I would not. I don't have no TV in my room. I have nothing going on. I wouldn't go out. I stayed studying until people got tired of me saying that I keep saying that I'm studying because I am. Like there's nothing else that I want to do but get my license. I don't care how long it was taking, but I felt like this was gonna be my last chance with Florida. Six and done. It's over with because I can't do it no more. I'm like, oh, and it's money every time. I was like, oh no, nah, we not gonna do that. We not doing no more. We not doing no more. This is it. So I was in there and I said, this time I'm taking all 5 of these hours. I was looking at I was at the screen like this, and I kept reading until I understand what they're asking me. I was looking for every trick. I was looking for bold letters. I was looking for distractions. So I'm like, oh, that's a distractor. They're not really talking about that. This is what they're talking about right here. Oh, there we go. We got you. I got you. I got you. This is what they're talking about. I was going in on that test. I said, I am not coming back. This is it for me. I have to pass. I put Felicia, for my name, Felicia RN, on my whiteboard. I put the axe graph. I did the method. Um, I looked at the question. I'm like, okay, they asking me. I would put that little part right there on the whiteboard. Boom, boom, boom. This is what they want. Then I look at the answers, and then I look at what I wrote. All right, I was an inspector on those questions. I said, this is it. I have to get this. What is it that I'm not getting? There is something here that they want me to know. I was taking all 5 hours. I don't care if they was calling me slow boat. I don't care. I knew I was walking out there and I'm gonna pass. And I when I walked out that center, you never feel who feels good. Like the last time I said I felt good, it was a total fail. I was too confident that time. And I think that was my first or second try. I was too confident. But this time I felt like, wow, what the hell? I was like, what the hell? But at the same time, I was confident in my answers. I looked back and I thought about it and I was like, you know what? Every question that I did my best. Every question that I did, I looked back at it and I said to myself, is there anything else that I would choose apart from this answer? Is there any other answer that would be better than the answer that I chose? And I told myself, no, there's nothing else that I would choose. And once I said that to myself and I looked and I said, all right, there's nothing else that I would choose. Are you sure, Felicia? There's nothing else you would choose. I said, no, there's nothing else. I'm not going to change my answer. There's nothing else. I kept going. I kept going. I didn't change my answer. I looked. There's nothing else I would choose. It's nothing that I regretted on that test. All the answers, all the questions that I was getting, the answers I was choosing, I kept saying to myself before I clicked, because I took my hand off the mouse this time. I had my hands at my side on my lap. I was like, there's nothing else that I would choose. To be honest, I'm gonna go ahead and hit that next button because there's nothing else I would choose. This is the only most right answer that I could pick. Everything else was like iffy. It was like it was something I'd never heard of. I'm like, I never heard of it. Even if it was a drug, I would look at the ending of the drug, the suffix and stuff like that. I was like, hmm. And then I would look back at what the disease are, the situation is, or what they're talking about. I'm like, all right, would this drug go for that? What is a sulfur? Nah, I think I need something like a steroid for this one. I'm like, this looks like a steroid up here. I'm like, I never heard of this one. I'm not gonna choose that. I don't even see. I never seen that in my book to be honest. So I'm not gonna choose that. And that's what worked for me. It was just critical thinking, content, because some background on something about each disease. I felt like, okay, I might not know exactly what the but I knew what section of the body that disease is, like Gullion bear. I don't know if I'm saying it correctly. Excuse me, but I think it was Gullion bear Gullion, something like that. Paralysis from the lower extremities all the way up. That's how it attacks. That's all I knew. So when I got something on Gullion, I was looking for I was looking what they're asking me about Gullion, if they want me to look for a medication for Gullion, if they want me to teach or educate about Gullion, it was something like that. I look for my answer. I go hunting. Boom, 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 boom. That doesn't talk. That doesn't have nothing to do with Gullion. Gullion, I think, as last time I remember, was about paralysis. So they need to be somewhere in paralysis mode here, and that's how I was seeing it. That's how I was seeing it, and I don't know what was happening the last 5 times, but Princeton review, I can swear on it. I put my hand on Princeton review, and it tells you will get. It guarantees you that you will pass. See, I took the free thing. I was like, all right, you said I'll pass, so I'm doing this every day, 20 from each section every day, and I was doing it, and I did it in. I actually was reviewing it in less than a month because I didn't start till around February with Princeton review. I took my test in March, of the end of March. I was between December and January. I was focusing on Dr. Z videos on YouTube, and just I was using Archer at the time and trying to use his Ask Graph and method with Archer. But it worked, but I felt like Archer was too much swaying away from what I'm trying to achieve here. So, but yeah, Princeton Review, I highly recommend it. It breaks it down in sections. I don't know any other bank that breaks it down in the sections that the NCLEX is giving you question questions from. Um, Princeton Review. That's all I can say. It was the breaking point for me. I don't know what I would do without the Princeton Review because I actually understand in every section that I pick, I looked at how they're asking me the question, and then it got repetitive on how they're asking me the question for each section. If it's management of care and I'm getting the question this way, and then I took like 20 every time, 20, 20 set every day of that same, in that same category, I was getting it. I was understanding. Then I read the rationale on why I got it right. I was right on how I got it right, the way I was thinking, and what they wanted me to look for. So yes, guys, we're hitting the 30-minute mark here. So I'm gonna go ahead and cut the video short. Well, not short, but yeah, cut the video because that's my point, and that's my tip. Is It's really about understanding content and critical thinking. It's a mix of both, and I feel like I didn't know everything. but I broke it down. I actually used my comments. I'm like, I'm talking to myself in my head because I can't talk out in the center, and I'm like, would I do this? And that's my face in the examination. Would I do this? Do I look competent right now doing this, choosing this answer? I was doing all that. I was too into that test. I was like, this is my sixth try. Is something got to flip today? Something got to flip because I'm turning 30 this year, and I said I need my license at 29. I need my license. I need to be going into my 30 with my license. With my license. I need to be going in my 30 mark with my license. I need to start getting this experience. I felt like I was missing out. I've been out since 2020. I should have been in there during the pandemic, getting it in and stuff. Like this should be easy peasy this year. Like, and I want to be in ICU, but right now I already got a job in I got a job in less than a week, guys. In less than a week from getting my license. I knew my results the next day, 6 o'clock in the morning. It was posted on MQA for Florida. Um, I I was when I tell you I was crying. I was on the phone with my boyfriend, and I was checking it. You know what? When you take it so many times, you're just on there like, yeah, I don't know how I feel like. Let me just go on here. The first thing I saw as soon as I log in, license number. I felt I had pain like in my chest. I felt pain in my chest, y'all. I really felt pain because I had a big gap. I was like, oh my god, oh my god. My boyfriend was looking because he was on FaceTime. He was looking at me in my face like, oh my god, you okay? Because nobody knew I went to go take this test. Nobody knew the date. It was gonna be sometime this year, but no dates. Nobody knows my move. Not even my mother. Nobody knows. And yeah, I threw up after I was crying. I threw up. Whew, I needed to get out. I had fun. I have been ever since the 29th of March of 2022. Since that day, I've been going out. I felt free. I felt free. Well, let me tell you guys, when you pass that test, it is the best day of your life. Okay? It's the best day of your life. For real, for real. Yeah. For real, for real. The best day of your life. Now I be bored because I don't start until the 25th of April. Okay, so I passed on the 29th of March. I received my license in the mail on the 5th of April, plus a call from recruiters pretty much for the HCA hospital. And I did my interview on the 11th. Yeah, I did my interview on the 11th at the hospital, and I was hired same day. I did two interviews, third floor, fourth floor. They sent me right on up. I got hired same day. I started my and I applied for uh, the new nurse graduate residency program. Even though I've been out since 2020, they still gave it to me because I've never worked as a nurse nowhere. So that counted in their curriculum or requirements. So they gave me the residency program. I wanted to go ICU, but I was like, all right. They gave me med surge, and that's fine. Okay, I'll get some experience. That's cool, but I'm going in that ICU. I'm getting in there. It's all right. I'm getting in that ICU. I'm getting in that ICU. I'm like, all right. You know what? All right, that's fine. Let me get that experience. Because I never worked in a hospital. It'll be my first time being in a hospital. So I'm like, I'm very timid. I want to get my skill set, and so I'm like, all right, I'll take med surge. I got like 6 patients or 7 or something like that. So I'm like, all right, yeah, I can have this one. As long as I'm getting in that hospital, it's good. It's all right. It's all right because I will be going to ICU for sure by any means possible. Okay. So yes, guys, that's all I have for you guys today. I will do more videos. I don't start until the 25th, my residency program, the 25th of April. So hopefully I'm able to do more videos on my journey throughout the residency, transitioning from new nurse and so on. And ICU, that's the main goal. So thank you guys for watching. Please like this video and subscribe so you guys can keep up and follow my journey. Bye.